Welcome faculty, fellow, and resident applicants to the Department of Radiology at the University of Colorado. We are delighted that you're interested in our program. This is a terrific department and a wonderful city and state. We take great pride in the quality of our programs and missions. We deliver excellent clinical care with our outstanding hospital partners, including the University of Colorado Hospital, Children's Hospital of Colorado, Denver Health Hospital, and the Rocky Mountain Regional VA Medical Center. We are nationally recognized leaders in medical education, using our bar lab to deliver just-in-time radiology knowledge to our trainees. In research, we will be opening a new 12,000 square foot state-of-the-art research imaging facility, which will allow us to drive discoveries in traumatic brain injury, Alzheimer's disease, drug addiction, cardiovascular disease, and cancer. However, while we enjoy excellence in clinical care, education, and research, above all, we want this department to be the best place to work. A place that draws people together because our culture is stimulating, exciting, full of great minds and positive attitudes. A place where people feel safe, respected, and treated fairly. A place which embraces the value of diversity, equity, and inclusion. A place we are all proud to call our department.
The Diagnostic Radiology Residency program is specifically designed to prepare residents for all types of future positions. Our residency provides an unmatched breadth of experience. While I believe we offer exceptional training, what I am most proud of as program director are our residents. They are an incredible group of compassionate, intelligent, and dedicated physicians who will be leaders in the field of radiology. Their commitment to each other and the bonds they develop will last a lifetime.
I'm often asked why I do what I do, and my most common reply is that I have the very best job in the world. I teach, I ask research questions, I take care of patients in the least invasive, most effective, and most technologically diverse field in the history of medicine. Interventional radiology has revolutionized modern medicine. With a needle, a wire, and a catheter, interventional radiologists can reach virtually anywhere in the body, deliver therapy, and finish the case with the application of a Band-Aid so the patient can go home that day. This applies to peripheral vascular disease, cancer therapy, uterine fibroids, pelvic pain, prosthetic hypertrophy that limits your ability to pee, and the management of osteoarthritis of the knee that limits your ability to run and jog and do activities. Much of what we do is based upon providing care that augments the care delivered by our colleagues in multiple other specialties. With the transition of the training programs from one-year fellowships to multi-year residency programs, you will at the University of Colorado gain the experience you need with multidisciplinary care that will empower you to be a strong advocate for your patients and an unparalleled team member of a wide variety of multidisciplinary teams.
We offer an integrated IR program that has a deep commitment to providing the highest quality training education at all levels, with a focus on developing future leaders in interventional radiology. We have aligned clinical, translational, and basic science research interests to support our mission of scientific inquiry and discovery. Our interventional radiology education programs consist of an integrated and independent pathway, as well as ESIR. We work together with our diagnostic radiology program to ensure that our residents get a comprehensive and diverse education. Our residents log between 1,200 to 1,800 cases spanning the gamut of vascular, oncologic, hepatobiliary, dialysis, pain palliative, genitourinary, and gastrointestinal diseases. They also have the opportunity to gain experience in pediatric and neurointerventional procedures. Furthermore, they participate in multidisciplinary conferences, outpatient clinics, and non-invasive vascular imaging. While providing an exemplary IR training experience, we uphold the principles of diversity, equity, and inclusion for our faculty, trainees, staff, and patients.
Welcome to the University of Colorado Bar Lab. Dr. Ristori and I are excited to introduce you to a novel concept in radiology education that disrupts the status quo and shifts the legacy paradigm of student learning. The Bar Lab or the Beginning to Advanced Radiology Learning Laboratory, was designed with a modern, technologically savvy student in mind. We have partnered with Philips Healthcare to develop a dedicated teaching PACS system, which allows for review and interpretation of imaging studies in an environment that simulates a real-world reading room. Our curriculum is integrated into required clinical rotations and delivered through a combination of individual learning, team-based exercises, and flipped classroom sessions. We're proud that our mission also includes several pipeline programs sponsored through the Office of Diversity and Inclusion at the School of Medicine. These programs provide a unique opportunity for early outreach and creation of an inclusive academic environment. We believe that radiology is the keystone of modern medicine and are delighted to share our vision and excitement for the future of medical education with you.
Hi, I'm Jody Tanabe, the Vice Chair for Research. Our mission is to conduct innovative, impactful imaging research in the basic sciences, clinical sciences, and in education. Our PhD research faculty use advanced imaging methods to better understand cardiovascular disease in children, the effect of obesity and exercise on bone health, and brain mechanisms of alcohol addiction. In the basic sciences, Dr. Yubin Miao's lab develops novel radiopharmaceuticals that both detect and treat melanoma and other cancers. Dr. Natalie Sirkova runs our small animal imaging core, which includes a 9.4T MR scanner, a micro PET CT, SPEC CT, and a new CT optical imaging system. We recently created in the department a Health Services Research Utilization and Outcomes Lab, led by Dr. Premal Trivedi. Faculty working in this area have identified gaps and disparities in the utilization of radiology services in interventional, nuclear medicine, and neuroradiology. This work is important because it speaks directly to healthcare delivery in this country, and it's certain to impact the way we practice radiology. We are very excited to announce a new University of Colorado Research Imaging Center. Thanks to partnerships with the School of Medicine, University of Colorado Hospital, and PharmaLogic, this 12,000 square foot facility will open in November 2020. It will house a state-of-the-art PET radiopharmaceutical production lab, a 3T PET MRI, and a PET CT, and space for a large bore 7T MRI. We believe that residents and fellows are integral to our research mission. Our residents participate in the RSNA ITAR, Introduction to Academic Radiology program, and the ABR Holman Pathway. Our residents have competed successfully for RSNA, NIH, and SIR research awards, and all of our trainees present at national scientific meetings.
The Department of Radiology at the University of Colorado is one of the best radiology departments in the United States. With a world-class medical school, 4 excellent hospital partners, state-of-the-art clinical and research facilities, and the Rocky Mountains in our backyard, there is no better place to work and play. Come join us and live the dream.